Hi and welcome back to Healthcare Today with Manvir Victor. And today I'm very privileged and honored to have a fantastic guest in the studio today. As we talk about healthcare, we have the current Minister of Health. And this is a fantastic lady that I don't envy because of the huge job that she has had right in front of her. We have, of course, Dr. Zaliha, current Minister of Health. Hi, how are you doing?
Hi, Manvir. Very good.
Thank you for being on this show with us. And
My
it has
pleasure.
been just less than 3 months that you were
Exactly.
appointed.
2 months, I think. 2 months.
Yeah, so I think on the 2nd or the 3rd of March will be, will
100
will
days.
it'll be less than 100 days. It'll be still 90 days. But I think you've had more than 90 problems already in this 90
Yeah.
days. I don't know, because it's a healthcare service.
Exactly. List goes on and on.
Yes, for sure. And let's talk about when you came in to this job, you were appointed as minister, and what were when you came into it, the first week at work, what were your immediate plans and ideas for the Ministry of Health?
Okay. Right. Thank you, Manvir. So I think, I mean, being appointed as a Minister of Health and with a background of a medical doctor, I'm a
Yes.
GP. So I think that helps in that sense that easier for me to understand what are the things that's going on in the ministry itself. But of course, there are lots and lots of things, as you said, 90 or more. But I
Right.
think more, things in the list to be, of course, to be understand as well as to maybe solve in a few things that when people consider that as problems or
Sure.
things that should be solved. So the first week when I came in, of course, being a medical doctor, this is the way we always do lah in solving problems or in diagnostic measures.
Sure.
Of course, because to understand the disease and to diagnose that,
Right.
that would be, I mean, appropriate to understand everything about the disease. So this is what I did. So 1 week, of course, is not enough. Even now, I'm still, trying to understand, because as I said, KKM or Ministry of Health is not just a ministry, but it's a mega ministry,
Right.
and it's the second biggest ministry after Kementerian Pendidikan or the
Yes, education.
education minister. So ministry. So I think this is where the challenge is, lah. And then of course there are lots and lots of things in the ministry, and we are also serving people. I would say I always say this, because half of people starting from the womb up to the tomb. So
Yes.
it's the whole life of people is about health at any level.
Right.
So this is something very big, Manvir, and I think, of course, it's not easy, but it's challenging. Of course, I have that ambitions to, of course, try to the level best,
Right.
to solve whatever problems that we have, as well as to give the best to the people.
Sure. And I think one of the key things about a Ministry of Health anywhere in the world, in whatever country it is a large percentage of the job is reactionary in the Ministry of Health, you only go to a doctor, as a GP, or you only go to hospital when something happens to you,
Exactly.
right? So it's always an emergency situation. You go to a doctor when you have a flu, cough, cold, you get COVID, then only you go to the
Yeah.
hospital, right? So the Ministry of Health itself and the health facilities are receiving people in their most dire of circumstances, and it's difficult to legislate for this. You don't know that, for instance, we're coming out of this pandemic. We didn't know the amount of people that would suffer from this at that time. Suddenly you're looking around for ventilators, you're looking around for
Yes.
everything.
Yes.
So we are the industry itself very reactionary to a lot of things. But there's obviously a certain percentage that we can plan for and make sure that we're ready for in future, right?
Okay.
And from what now the industry is coming out, the ministry is coming out of this pandemic, what are the main cruxes of things that they want to fix first off?
Yeah, I think, as I said, diagnostic is there. We have to do some diagnosis to solve things. So I do believe that because of the pandemic, that we are so focused in the past 3 years on pandemic
Right.
issues. Okay, so when now we are not yet, of course, come out 100% of the pandemic,
Sure.
but we are living the pandemic and
Right.
going into endemic. Okay, this is where I think we can see the upsurge of patients. Perhaps previous pandemic has been like adding to adding to what we are having before the pandemic.
Right.
So we are seeing cases, for example, NCD cases,
Right.
non-communicable disease, are increasing in numbers, and it is more, in fact, more in the youngsters.
Sure.
What has happened?
Right.
People are asking that, and that was why I think one of the reason. This is not the only reason. That one of the reason that perhaps putting congestions into our facilities,
Sure.
as well as to the EDs or the
Right.
emergency department. So when I see this, then of course I can see that actually whatever problems that we have in the ministry or even in our facilities, we can see is actually it doesn't stand by itself.
Mm-hmm.
It is always interrelated
Right.
to all the factors that
Yes.
were contributing to the problems. Okay, so the best thing is, I think, is of course it will be long term, of course,
Right.
but we should start talking about this. People has to be healthy.
Right.
So we have to move from sick care to healthcare.
Healthcare. Right.
Yeah.
Yes.
If we do that, then of course, if people are healthy, it's not only reduce the burden of workers as well as the facilities that we're having in the in commentary or in the ministry, but you can understand that when people are healthy, what is the impact of healthy? You become productive,
Right.
more productive. So
Sure.
you are giving back to the community, you are giving back to the nation
Right.
to be healthy. So this is where I think one of my focus in the ministry is, of course, the primary care, the
Right.
primary care or the promotive medicines. This is where I think it's not only the ministry has to do the job, but
Right.
as well as people like you, perhaps you are the one who are actually talking to people.
Right.
Must help the ministry to promote about health. We are also doing on our part, of course.
Right.
But I think we need the whole government, not only yes, the government also. It's not only KKM or it's not only our ministry,
Yes.
but as well as other ministry is also has to also be involved, and it is all about health.
Yes, and I think that's the one thing that I've seen. I mean, I've worked overseas here. I mean, with international organizations as a patient advocate, and I find that healthcare is unable to communicate well with the public because they're talking two different languages.
Exactly.
One is very technical, very scientific, and people understand things in very simple, plain language, right? And we're not able to do that well enough yet. So, and like we were just saying, like, when there are obviously elective cases or whatever has increased because, for the 18 months that you couldn't have operations, and suddenly, there are more of these operations that need to be held now, and you have the cases. And as a patient advocate, I can tell you, and because of this podcast, I get reached out by people who want to go to a private hospital and they don't have any beds. And the private hospital is telling them, can you please go to the public hospital? So from private, now they have to go to a public and wait longer because there's a line there as well, because you've been waiting in line in the private. And I've had children, I've had friends, family calling me and telling me they're trying to go to the system. They're trying to go to the public system. But the public system is already packed, and then the private is also packed. They send them, as a makeshift. I cannot help you. Can you go there? And again, so the expectation that people have is, my child is sick. I am sick. I need help. And how do they get help? And so I guess it adds to the burden that you hear about, and and I see you on your Twitter and everything that is going on, and everyone's complaining. I think Malaysians, I will say, Malaysians love to complain. They don't have a solution to it, but they think that the solution for them is to just complain.
But Manvir, I think I look it in a positive way. As I said, now another thing is this is the new government.
Right.
Okay. And what has happened for the past years is something like I say pandemic. People has been so stressful. a lot of things. It's not only about health, it's about their living,
Sure.
whatnot. So I think this is where when they are complaining, I look at it in a positive way. Also,
Okay.
though sometimes you as the people who receive your bill, like, "Oh, what's going on? It's so stressful to give all these complaints, whatnot." But I think in a positive way, I think people wants to see change and people wants to see
Right.
the solutions to the problems they are having.
Yeah.
Especially the long standing problems that we have, of course, in our health system and our services and whatnot. So I think this is where, at least as a minister, I have to look it that way.
Sure.
Then only you will think about solutions. If you think
Right.
that it's complaints and complaints, it's just like, oh, it's complaints, so I just
Right.
close your
Yeah.
ears, shut your eyes, and that's it.
Okay.
But if you think it positively, I think you will try your level best to find the solutions.
And talking about solutions, of course, the continuous improvement of the healthcare is obviously necessary. What is first or few of the things that are on your list now to continuously improve healthcare?
We are near budget.
Well, yes, I know the budget's coming out tomorrow.
This is what, of course, I hope that we will get the budget that we propose
Yes.
to the government. Though I think it's not that easy, as we know that our country is actually facing with a high debt. We
Yes.
understand that. We
Yes.
understand it. But at least we hope that whatever we propose, we can get
Okay.
to the most, so
Right.
that we can, because of course we have plans for the next year. What we're going to do. So we have enough budget. Not to say enough, it's of course not enough, but at least sufficient budget to
Right.
help with the things that we are planning. And I think that will be very good. That is my first hope before budget.
Right. Okay, so you obviously asked for a certain
We have
percentage.
proposed, yeah, we have
Some,
proposed,
you're not going to tell me that.
Yeah.
Don't yet. We'll wait for the budget.
Make it the budget.
Yeah, we'll wait for the budget. The Prime Minister, he has a bigger problem.
Oh yeah.
He has everybody coming to him with a bill.
Indeed.
So, and now talking about continuous improvement, I think one of the things that has been proven in the world is that
Yeah.
wellness versus healthcare, sick care, right?
Yeah.
Well, keeping the people who are well, and you are aware that I've had a kidney transplant. So for the 10 years that I was on dialysis, obviously I couldn't work, right? So I was not able to contribute to the country. And globally, we've seen that people who've had these kind of elective operations, necessary operations, are movable barriers that help the country in the long term, because then they are able to go back into the working life and contribute to taxes and not being sick because there are some illnesses that we can help immediately, some illnesses that you can just prolong it, and it saps a lot of money from the healthcare industry, doesn't it? Right. And okay, now talking about continuous improvement and also about digitalizing of healthcare. How is that going? Why we should be doing this?
Yeah, I think of course this is the new era of people are looking at digitalizations of the system. I think this is something that we should sit upon it. Digitalization, of course, I think will help a lot in our services system.
Okay.
Right. We already have something in place, for example, system in it, but I think it need to be strengthened. It need to be expanded. It need to be upgraded.
Right.
This is something that I think is a necessary now. It's a
Okay.
necessity now. It's a necessity now. Okay. What are the things that we have in our system? We of course we have, like, for example, now we are coming up the new one we are coming out with EMR, they call it electronic medical record.
Yes.
This is very important.
Yes.
Okay. We are going to do it. The pilot project will be in hospital Seremban.
Okay.
So I hope that because actually medical record is very powerful, because it has everything. As I said,
Yes.
it is from womb to tomb.
Yes.
So every level, every age, for example, there is always a record in there. So EMR is very important. So we have to have a system which is can of course sustain as well as resilient.
Right.
This is very important for, I think, because There's even if we use handphone after a
Sure.
few years,
It's obsolete, yeah.
obsolete, and we have
Yes.
to change. So this is also the we have to think about. So I think digitalization, not only we know that it will help in delivery system, but it also is very essential and is needed now.
Right.
To help some of I think that will actually help us to alleviate some of the problems that we're having in our services, for example in ED.
Right.
For example, if we have a good system and when people come, we can quickly register them
Yes.
via our system, and then quickly we can send the triage will be done, which are the doctors they have to see, which are the for example if we see like for example beds, as you say beds, yeah. So by the system we can immediately know, these are the wards that beds that are available in the wards, so we can quickly send the patients to the ward.
Right.
So we reduce the congestions in the
Yes.
ED. So
Yeah.
this is how I think the simplest way of looking at it, but of course they are more complex.
Right.
But I think this is time when we really now need to look into digitalization and really make it a system which is resilient as well as
Yes. I think
sustain.
this is you're absolutely right in that for the past 8-10 years that I've been a patient advocate, we've seen that necessity increase year on year, because you and me, we can get our Grab food or Shopee food or everything's digital.
Yeah.
But when we're going to the hospital, there's no data system there that has
There
that.
is
Huge,
we need to improve on that.
Yes, we definitely need to improve on that, and then also that the ED that Dr. Zaliha was just talking about is the emergency department. And it's emergency departments where everyone comes, it's last minute, it's bad, it's a dire situation. We need to be able to help those people as quickly as possible. Yeah. And once you've triaged them, obviously you have to move them to the next level, which is getting them a bed and so on and so forth. So this is where the system needs to be really enhanced. And so can I hope that that's in the budget for
there is.
That there is that allocation in the budget already. Fantastic, great. And you were talking about ED. You have been doing a little bit of a jalaja on your own. Yes, journeying to the hospitals.
Yes.
Tell us about why you've been doing that first, and where have you gone? What have you learned?
Yeah. Okay. Again, Manvir, I think of course generally I will know what is the problem. Okay. As a medical doctor, sure. Of course I know. But to be in the actual situations and to understand what is actually the problems is very essential to me. So I think that is why that actually makes me to go down to the some of the hospitals. I cannot go all, but I think I will try my level best. I have 5 years. Maybe perhaps I can cover the whole hospital. Okay. So when you go down, then you only know that what are the actual problems they're having.
Sure.
Different hospital will have different need or different urge. Some of the hospitals, they say that most of them are some of the people that I meet, the doctors, of course, they'll say that we don't have enough, and we need more.
Right.
For example, as I say, for example, in triage, the yellow zone, for example, they need more than one doctor there, for example. Right. So, or they need more ED or ED specialists, for example. So those are the things that they can talk freely to me. Some of the areas they need more space, for example.
Sure.
Like I think most of the hospital has this experience of COVID.
Right.
So the COVID has put them in real situation whereby they have to think fast, to have the creativity. Their creativity has to come in. So this is where when you go down, and as I said earlier, that the people's the sick people are numbers of people are surging up. So they need more space. Now, some of them are very creative. They don't have space in the ED. They built up, like for example, what you call cabin, just to put in patients there. Yeah. Or they put maybe some areas they put like just put what we call it's not partitions and partitions, and then just to make sure that people are sick people are safe, are well taken care. But of course it's not like the best. But at least this is what they have to do. So some of the hospital when I went there, say doctors are quite okay. It's quite essential. We can live with it. But the problems we have now is actually we need more nurses, we need more HAs, or MAs, they need more. So you see, so those are the different areas that they're facing with. So I think this is where I think when I go down and I heard by myself, I like to hear to people, and so we can actually know, oh, this is the problems, this is the diagnosis, this is the disease, this is what you have to do.
Right.
So different companies will have different solutions, isn't it? So I think of course I will go down.
Sure.
But of course people do not know that I'm coming down.
Yeah. Good.
I mean that's the way. If not,
They'll be prepared for it.
Minister come, all
Yes,
sort of people will come. So
it'll all look fantastic when you're there. And I really congratulate you for doing that, because I tell you, from a patient's point of view, it is really nice. You may be my doctor, but if you look at the sheet of paper in front of you and all my blood test results, you don't know me until you talk to me and you ask me. And the fact that you're going down to the ground is really testament to that.
That's good. In a sense, because I get the first-hand information, and I talk to patients as well. So I mean we have been like hearing or even read in the media, social media, saying that we have to wait for 4-6 hours. So when I go down, I said, does this really happen? Then only when you go down you can hear that. I mean, this is real.
Right.
This is what people are facing with. So we don't deny whatever.
Right.
I don't think denial is good.
Mm-hmm.
What you have to do is you have to understand, and then you acknowledge the issues, then think about the solutions.
And in the past 10-12 years that I've been involved a little bit here and there, and I get to understand that our healthcare system was designed many years ago for a population that's lower than today. I think it was 10 million. And now our population is triple that, right? So the systems and processes are not there. Because, I mean, if you build a hospital for 400 beds, it's got space for 400 beds. And now suddenly the community around it needs 800 beds. So therefore, you will find the hospitals with beds in the corridor, the beds everywhere. Like I was at Queen Elizabeth Hospital in Kota Kinabalu. During COVID, they explained to me that they changed the entire emergency entry area, which is in a tunnel of a sort, into a triage. So all the COVID patients are there, and they could put 50 or 70 patients there, and they were showing, the hospital director was taking me around and showing me this. And that's like what you say, creativity, the inventiveness, saving people's lives was more important. So it's a band-aid situation where they went out and did that. So which are the hospitals that you have visited so far, and what have you learned?
I went down to Hospital Klang.
Okay.
And then Putrajaya, so I went. Recently I went to HSI, Johor.
Okay.
So the rest, of course, I think the rest is I'm going to.
Okay.
And hopefully within this few years of my tenancy, I can go down and
Definitely.
But of course, before I go down, so I need to have some solutions for that.
Sure. I'm going to ask you, when you're talking about that, now the clinic kesihatan. Now, Malaysia prides itself in the fact that 95% of our population has access to a clinic within about 5 kilometers.
5 kilometers, exactly.
5 kilometers. That's 95. No, there's no other country in the world that has this kind of access. So that's fantastic that they can get there. Now, are we using them well? Because the clinic kesihatan are there to take care of the flu and cough and the minor things. You don't have to go to emergency department and clog it up,
Yeah,
so
I think
are people aware of this?
Yeah. I think this is where I think that the patients, but of course, clinic kesihatan, they have times, operating hours, because we're operating from 8 or 9 to 5 p.m. So that's clinic kesihatan. So that was, I think I can understand. That's why when they most of our patients are working, so they only have times after working hours, so they will come to the hospital to get treatments. Although it is cold cases like from flu, cough, like that. But I think we have to come up with. That's why I come up with suggestions. This is also being done. Some of the hospital or KK has done that.
Right.
The extended hours.
Extended hours.
Extended hours, so perhaps, but extended hours, so it doesn't have. It has to come also with some facilities.
Of course.
You know,
More
why
staffing.
people like to come to hospital because the some of the KKs they don't have the facilities. For example, the lab facilities is not open, and then of course maybe X-rays. The essential one, or the basic one. So that is why I can understand why people go to hospital, because if you go to hospital, then you have everything there.
Sure.
Labs are there, X-rays are there, even some maybe ultrasounds are there. So but of course that is why I think we have to increase our I mean, I hope the budget can help with this lah.
Sure.
Increase our facilities over there, and I would maybe add on the devices that that is essentials to the clinic lah, so that we can decount our patients from hospitals or from ED to the peripheral clinics.
To the peripheral clinics, because they have access to them.
Access to that.
Access. Now, talking about the overall healthcare, right? So obviously on Twitter, every other doctor or junior doctor is complaining about a lot of things.
Yeah.
Salaries being one, whatever facilities that they're talking about,
Yeah.
they are entitled to their opinion. They're absolutely entitled to their opinion, right? Now, but if you look at yourself being the Minister of Health, you are in charge of the entire healthcare of this country, whether it's private or public.
Yes.
And if I'm not mistaken, the number is about 350,000 staff. Staffing.
Throughout,
Yeah, so, and doctors are a small part of it. Obviously, then you have your nurses, which are a huge part of it, then admin and communication, everything else. What are the plans moving forward for Ministry of Health, encompassing both private and public as well, to keep people learning, to keep people improving, so that there's a career pathway that is better for them to remain within the system?
Yeah, of course. I think this is also an important issue that really need to look into and deep dive into that matters. Because I think, as I always say this. It is the system is a package of everything.
Yes.
Yeah. If you talk about building up a new hospital, because as you said just now, we're not enough beds, and the population is coming up, more and more. So of course, when we say it's a package of is the facilities, is the manpower,
right?
And then the manpower, there are several of that. There are doctors, there are nurses, MMAs, attendants and whatnot. There, devices as well.
Yes.
The services.
Right.
Yeah. So it is a package of all.
Right.
So I think moving forward is, I think we really have to, of course there is short-term measures, mid-term measures, and long-term measures. Okay. What we have to understand with the short-term measures is to, of course, identify. I will say this is to understand the problem statements.
Right.
The current problem statement. That should be the first part we have to to understand as well to solve it. Then when you come the policy matters, which policy, of course, it is sometimes okay. You really have to focus, get the best policy that you for the sustainable as well as resilience kind of policies to the public care or public health. So this is where I think it's a bit it's challenge. It's very challenging, but somehow as a minister you have to do it, because people would hope to you as a minister to come up with solutions and to give the best for the people. So this is where I think, as I said earlier, that it has to be done in that manner. And I think another thing is, as you said, public-private partnership also has to be taken into consideration, because I think at the end of the day, it's not whether, of course, when we say private, is of course talking about their what they can get from the services, but I think it has to be win-win situations. So if it's win-win situations, so we really have to sit down and talk to them and see what are the things that they can do to, of course, to help the nation, as well as to reduce the burden of the public services, and both of the parties get the best,
Sure.
and people also get the best.
Yeah,
So
exactly.
that's how it needs.
And it's very hard to juggle.
Yes, it is.
Yes.
It is. And the other thing I think is the whole government.
Yes.
This is the thing that we always say, that the whole government has to be involved in health also.
Yes.
Now, talking about health, as I said, if we talk about from womb to tomb, that is the area whereby the Kementerian Pendidikan or
Sure.
the education ministry can play their role also.
Right.
We can put at least, for example, educations of health in
Yes.
in the curriculum.
Yes.
Why
Yeah.
not?
Yes.
So as the other ministry and departments. So I think that this is I think way forward,
Sure.
and we really have to make things possible.
Right.
And I think the best is, of course, I always say this: the best solution is, of course, to involve everyone. That is the
Yes.
stakeholders. There are the
Right.
stakeholders of the.
And that's fantastic because, I mean, the numbers I was just giving you, like 340,000 healthcare professionals in this country are taking care of 32 million people. It's like 1% taking care of 99%, right? And
Yes.
so it's a daunting task, and you can't do it if you don't engage all the stakeholders.
Yes,
and I think a huge amount of the stakeholders is the public, patients, that can help move healthcare as well, give you different opinions, given different thoughts. Because one of the things that WHO has been doing over the past few years, and I mean, congratulations on your post in the WHO as well,
Thank you.
that you were recently in Geneva, and is empowering patients globally to be able to talk to their healthcare systems. And Malaysia is the model. I can tell you that Malaysia is the model for that in WHO, because we are the only country in the world that has the patient safety within the MOH itself. And I sit, because I'm the president, I sit on the Malaysian Patient Safety Council as well. Yeah, so they have the voice of the patient, and I know one of those things that you're alluding to is that stakeholders, obviously the biggest number of
As you said
stakeholders.
just now, we only have about 300,000 workers or health
Yes.
workers throughout,
Yes.
but we're taking care of about
32
million. So,
Yes.
yeah.
So the
That's a
1%
huge-
taking care of 99% is difficult, extremely difficult. So any parting words from you? I mean, thank you for your time, but any parting words on what to look forward to for the Malaysian public?
Of course, I would like to see the Malaysians be healthy.
Right.
Of course. So for that matters, I think people has to be healthy, and we are coming up with the please be involved also with our programs, especially in the promoting health, talking about wellness, and of course I think I hope pray hard that perhaps we can actually achieve whatever we need for the best for our health system and our services. Thank you.
Okay, great. Thank you so much, YB, for being here on the show with us. Healthcare today with Manvir Victor, and we have the Minister of Health, Dr. Zaliha. Thank you very, very much for being open, listening, constantly engaging with us, and you can definitely use us anytime to deliver messages to the people so that how they can stay out of hospital. I think that's the key thing about the Ministry of Health, right? Your job is to try and make people not come to your place.
Yeah, that's the KPI. Thank you very much, Manvir.
Funny. Well, thank you. Well, we'll be back again later. Bye.